home. AI technology will soon be helping fight cancer after NHS England partnered with artificial intelligence to detect approximately 3,400 cancers and save hundreds of lives by 2025.
Yes, well, England is the first country in Europe to implement a screening initiative scale with 200,000 scans expected to be generated by 2024. Via lung nodules, the audience-designed AI solution automatically detects, measures and classifies and tracks the growth of pulmonary nodules on chest CTs.
Well, Lizzie Barclay is the Medical Director at Aidence, which is a medical equipment manufacturer, and is indeed a former NHS radiologist. Thank you very much for joining us. This sounds like a cracking breakthrough.
Hi, thanks. Yeah, thanks for having me. Yeah, absolutely. So just to tell you a little bit about the background of the targeted lung health checks. That's what they're being called, this programme by NHS England. There's been lots of research over the last 5-10 years and longer looking at, is it possible to actually screen for early stage lung cancer so that we can diagnose lung cancer before individuals get symptoms of it? Because unfortunately, by the time you get symptoms from lung cancer, it's quite far advanced, that the treatments are less effective and it's not really possible to cure the cancer. So the idea was of screening, can we actually pick it up when patients or individuals don't have symptoms? Can we detect it on CT scans? So it's using low dose CT scans, so it's very low radiation dose. And can we then detect these early cancers and therefore save lives?
I mean, do you see this type of thing as the future technology playing an increasingly important role in kind of medical diagnoses? Is this really where AI is going increasingly?
Yeah, I think I want to be clear that I don't see, from my perspective, I don't see AI replacing our humans, our radiologists, doctors who look at medical imaging and provide diagnoses. I certainly don't see it replacing them. I see it more as a complementary sort of support to help the workforce. So I know there's been a lot in the news recently about the radiology workforce, certainly in the NHS, that is kind of lacking. I think we've probably only got about 2/3 capacity of what we really need. So I think there's been a huge push to try and put more investment into actually training more radiologists. But the combination of having more human radiologists working alongside AI, almost to have that second pair of eyes to help detect early diseases, I think that's kind of the way we're going. It's that teamwork between the humans and the AI.
Brilliant. Well, it's interesting stuff, and hopefully, fingers crossed anyway, we can get more breaks. So I suppose as well, it potentially could remove human error from the process, which is, I suppose, a good thing, isn't it?
Yeah, definitely. I think something that we know computers are good at is not getting tired, not suffering from fatigue, being consistent. So what we hope is, whereas obviously the pressures that humans are under and the distractions they might have when they're being asked to look at multiple different patients at the same time, hopefully having AI there sort of as a backup or supporting the radiologist, that will help reduce potentially missed subtle nodules by helping point them out and providing the information that the radiologist needs to make the right management decision for that patient.
Thank you so much, Lizzie Barclay. Fascinating stuff, and good luck with the work that you're doing. She's the Medical Director at Aidence, a medical equipment manufacturer and former NHS radiologist.
Yes, well, it just sounds like a pretty major breakthrough, doesn't it? Right, well, we're going to go into my inbox now.